Hi guys, in today's video I'm going to talk to you about if oatmeal can help to reverse fatty liver or MASLD/MASH. Hi guys, it's Bally Specialist Liver Dietitian. In today's video I'm going to go through the current evidence on whether it's beneficial for you to add in oatmeal, so porridge and oats, into your diet to help reduce and reverse some of that buildup of fatty liver. In today's video, I'm going to cover what are the key criteria that induce MASLD or fatty liver and what are the cardiometabolic risk factors. And then I'm going to go through the evidence on how adding oatmeal can reduce or reverse some of these factors and whether I think it's something for you to add into your diet. So let's get started. So the first thing is what is MASLD or fatty liver, and that is the presence of fat buildup inside your liver plus one of these 5 criteria. So for you to have fatty liver disease, you will have some buildup of fat in your liver like this here or like this, and you'll have at least one of these following 5 things. So you could be overweight or living with obesity, you could have pre-diabetes or type 2 diabetes, which is tested by these things here. You could have hypertension, where your blood pressure is a little bit high. You could have high blood triglyceridemia, which is when the triglycerides in your blood are very high. Or you could have an altered HDL to LDL cholesterol ratio, which is essentially when you've got high cholesterol. Now, some of you may have all of these things, or you may just have 1 or 2 of these things, plus when you've had your tests, you've then had a little bit of buildup of fat in your liver. So why is this important? Because actually there are lots of different clinical thresholds for these things, and the common criteria for you to have these, you must have at least 3 of the following metabolic risk factors for you to have MASLD as well. So that would be the abdominal obesity, the elevated triglycerides, this range of LDL to HDL cholesterol, elevated blood pressure, and an elevated fasting glucose. You will likely have 2 or 3 of these as well. Why am I talking about this in a video about oatmeal? Because actually the research for oats has been shown to reduce some of these factors. So let's get into it. What is oatmeal? So essentially oatmeal contains a prebiotic called beta-glucan, and beta-glucan helps to feed some of the beneficial gut microbiome and bacteria. So this is going to be things like it produces short-chain fatty acids, which help to nourish our gut lining and have some anti-inflammatory products as well. The oats also help remove and reduce some harmful bacteria in the gut and keep them moving. And that's because it's a soluble fiber. So essentially, it's helping us keep a more regular poop. And as we're pooping more, we're reducing and removing some of that harmful bacteria that's been translated from the gut to the liver. This then has an indirect effect on actually reducing liver inflammation, is what we believe. So what does the current evidence say? So these studies here looked at the inclusion of beta-glucan, which is oatmeal, and they added it to people's diets. Now they did it mainly in these studies looked at people who had high cholesterol and were also diabetic, and these studies looked at it in just with people who had high cholesterol. The studies ranged from 2 to 12 weeks. Most of them, participants stayed in the study for 4 to 8 weeks. Now, what did they find? So they had a beta-glucan dosage of greater than 3 grams a day, which is the recommended amount. And what they found was in LDL cholesterol, which is the type of cholesterol which can, if it builds up too much, can be harmful, they found that it can reduce the amount by 12 to 15%. They also found it helped to reduce total cholesterol in this study by 6 to 9%. In this study, they found no change in HDL cholesterol, and in triglycerides, it was pretty inconsistent. So they found no change, but one study showed isolated reduction in this environment. So not very robust in these results here. What were some of the limitations of this study? So majority of them had a very small sample size. So it's very difficult to see if it was actually the beta glucans which had a significant effect, or whether it was another part of the study, as it's very difficult to isolate and change and extrapolate just for beta glucans. So actually, some of the ones that had no significant effect, it was likely because of the study design and the way the study was done. So what about other things? So HbA1c, fasting glucose, and blood pressure as well, because we know that actually these are some of the other factors which can affect and impact MASLD and buildup of fatty liver. So these 4 studies looked at adults with type 2 diabetes, and we know that people with type 2 diabetes can also have fatty liver and fatty liver buildup. They also looked at patients who had high blood pressure. So if you're somebody that's got high blood pressure, now they had a slightly higher dose of beta glucan range. So we're looking at above 3 grams, and some of them even had up to 5 grams a day for a stronger effect. Now what did they find? They found a very small reduction in HbA1c. This is one of the markers of diabetes. And they saw a small reduction in fasting glucose. When testing for insulin resistance in this patient group, they saw another small reduction, although non-significant reduction, in fasting glucose and insulin resistance. Now we saw slightly better results in blood pressure, so this small reduction in blood pressure actually makes a big difference. And actually for those who stayed in the study for longer and continued the effect, they saw their blood pressure reduced after 8 weeks, which is an interesting result. What were some of the limitations of this study? So some of the limitations of this study were that the evidence and imposition of HbA1c, we know that HbA1c isn't the best marker in those with liver disease, just because they can have enlarged spleen, and actually doesn't represent a true value of their blood sugar. Overall, the improvements were pretty small, and they pulled results together to try and improve their results. But when they pulled the results together, the sensitivity analysis showed a small amount of significance. I think what this means is that actually in isolation they might not have had much effect, but actually when they looked at all the other results on all cardiometabolic risk factors together, we saw that overall adding oats into the diet showed more of a beneficial effect to these individuals. So what does that mean in terms of how much do we actually need to include and add in? So 3 grams of beta glucan is actually 60 to 80 grams of rolled oats, and these studies did this for 4 to 8 weeks. So you can see the equivalent of whole oats is quite a similar dosage here. So it's going to be 60 to 80 grams. For blood pressure reduction though, they found 100 to 125 grams made a big difference. However, if somebody's overweight and we're trying to lose weight, adding this amount of oats could increase the amount of energy and calories they're having. So actually having too many might have negative effects on other things. But we can see that 3 to 5 grams is probably the threshold here to have some beneficial impact. What are the overall limitations of all these studies? Look, the sample sizes were quite small and the results were inconclusive and quite heterogeneous. So there were lots of different results for lots of different studies. But we know with dietary studies, it's the 1% effect. If we can add in 30 to 40 grams of oats per day, and that has a 1% reduction in HbA1c and cholesterol and liver fat, then actually over time, that's going to have more beneficial effects longer term. So I think although the results weren't very robust, I think if we take a big picture and zoom out, they're likely to have some more benefits. The second thing is we don't eat oats in isolation. We pair oats with fiber, with nuts, with fruit, seeds, and all these things can also have beneficial effects on our gut microbiome and on our liver health. So what we don't have the research for is when we have oatmeal and we pair it with other prebiotics, do the results compound and improve, or does it worsen liver health? From my experience, when we've added oatmeal to people's diets and they have it for breakfast, we see an improvement in their stool and their bowel. We see an improvement in their blood sugars, and we also see an improvement in their liver fat when they combine it with other interventions. In isolation, maybe it might not have much effect, but in combination with lots of other dietary lifestyle habits, then actually they may be a powerful tool to help reduce some of that liver fat and build up. And as you can see here, you can have oats lots of different ways, and you can get creative and make sure they're fun as part of a good balanced diet. You can make it lots of different ways, and I'm going to go back to my 4 ways of making a meal. Have your base, 30 to 40 grams of oats, 3 to 5 grams of beta-glucans, your milk alternative, and then your proteins, your fiber, and your toppers, and we're good to go. Is there need for more research? Yes, there is. We need more human randomized controlled trials in people living with MASLD and have liver fat. And we need to see how much of the oat beta-glucan and whole oats contributed to reduction and reversal of that liver fat. How do oat beta-glucans and other phytochemicals work synergistically, so together on liver health? As I was talking about, what food should I pair it with? Is that going to have the maximal impact? Can we make the oats better? So we know the oats are processed, but can we make the oats to have more beta-glucans in them to make them more powerful and have more health benefits? And how does individual gut microbiome affect this? Because we know some of the results and individual results might have been because everybody's body is different. So people with the worst gut microbiome may have had more beneficial impact, but actually people with a more diverse gut microbiome, they might have seen much smaller results. And what are the specific microbial and short-chain fatty acid profiles induced by the beta-glucans in humans, and how do these link to improvements in liver health and MASLD and metabolic syndrome? So I think there's a lot more research to be done, because majority is done in people with type 2 diabetes and in mice, and that doesn't always translate directly to liver disease patients. For me, I'm taking it as a win. If I was suffering or living with fatty liver disease at the moment, I would add a small amount of oats to my breakfast, maybe 3 to 5 times a week, and I would pair it with another fiber source such as walnuts, almonds, chia seeds, and 1 small portion of fruit, and an additional protein source such as whey protein. Together, I think this makes a strong breakfast item to help reduce some of that liver fat and improve my gut microbiome. I hope you found this video useful, guys. Thanks for watching and listening. And if you want some extra support to help reverse your fatty liver, feel free to get in touch with me. Cheers.